Hello, my name's Catherine Plum and I'm a respiratory physiotherapist at Respiricare Limited. This short video covers the topic of chest clearance techniques and is aimed at anybody who has increased or retained secretions on their chest. This could range from something very simple like a chest infection or could be something more chronic such as COPD or bronchiectasis. Sputum or mucus is a natural product of the lungs and its role is to trap foreign material such as anything inhaled into the lungs, dust particles, bacteria, dead blood cells, white blood cells and other immune cells. Normally, there are cells within the lungs called cilia, which are hair-like structures which work to waft the sputum or the retained secretions up the airways into the throat where it would normally be swallowed. Medically, we call this the mucociliary transport system. Smoking specifically causes damage to the cilia cells, meaning that cilia are not as effective as they should be at clearing mucus from the chest. So why is this a problem? Well, if secretions are retained within the chest, it can mean you are more likely to have an infection and it can make breathing more difficult. So let's move on to treatment. The mainstay of treatment is to try and help the lungs clear sputum from the chest more easily, and this can be done in a number of ways. So firstly, let's talk about hydration. The cilia in the mucociliary transport system work better if the lungs are well hydrated. So try to drink between 6 and 8 glasses of fluid a day. This can include anything ranging from water to fruit juices, squashes, and anything that's not caffeinated. Just remember, if you're drinking caffeinated drinks, these are actually diuretics and will dry the body out rather than help increase your hydration. So exercise is also really helpful. Remember, when you exercise, you naturally take big deep breaths and this helps the air get behind any secretions in the chest, which means they will be easier to cough and clear. Even if you aren't feeling very well, maybe you have a chest infection, try to do a little bit of exercise. We recommend just some short mobilisation every hour is the thing to do. Even if this includes just walking to the toilet or walking around your garden or your front room, this will be enough to gain benefit. Let's talk about pulmonary rehabilitation. Now, this is a programme of supervised exercise which you may have been referred to. This would involve you exercising twice a week for around 6 weeks' time. And this is very good also at making sure that you are doing that regular exercise and thereby helping to clear your chest. So as well as keeping mobile and exercising and keeping yourself well hydrated, there is a specific breathing technique you can use as well. We call this the ACBT, or the active cycle of breathing technique. Now, you may have been shown how to use this in the hospital setting, or you may have been shown how to use it by a physiotherapist in pulmonary rehabilitation, but it is really quite effective at helping to clear the chest. And I'm now going to talk through the various elements of this. So the first section of the active cycle of breathing is what we call breathing control. This just involves you sitting in a nice relaxed position with your shoulders down and relaxed, with preferably your palms facing up on your knees. You want to make sure your arms are not bracing and that they are nice and relaxed. If you can then place one hand on your tummy, as you breathe, you should feel your tummy rise and fall with the action of breathing. We would like minimal movement from your shoulders. So do that for a couple of minutes until you feel nice and comfortable and that your breathing is nice and relaxed. The next section is the deep breathing section, and the aim of this is to take nice big deep breaths so that you can get the air behind any stuck or retained secretions. This will then be easier to remove in the next part of the cycle. The way we do this is to take a really big nice breath in and then hold your breath just for 2 seconds at the end. And if you can, without letting any air out at all, just try and take an extra little sniff on top of the breath. So let me just demonstrate this for you now. Be a nice deep breath in first, a hold for 2 seconds, and then a sniff on top. So deep breath in through your nose, So we're now going to move on to the part of the cycle which is the huffing, or FET, the forced expiratory technique. And there are two types of these. So the first of these is called the small long huff. It involves taking a half breath in and then exhaling with an open glottis and open throat, which means that no sound will come out at all. It's a bit like when you steam up a mirror to clean it. So half a breath in. This technique helps remove secretions from lower down in the airways up into the upper airways. And this is a short, sharp exhalation, trying to encourage any secretions which are in the lungs up into the throat area of the chest. It involves a deep breath in and then, as I said, a short, sharp exhalation, something like this. It's a bit like if you've ever steamed up glasses to clean. It's the same action. The FET, the forced expiratory technique, or the huff, should be carried out a couple of times, 3 or 4 times. And normally, if you do have secretions on your chest, you will actually hear some of those moving around. So then the final part after you've done that is to do a cough. And a cough will bring any secretions which have risen up into the throat area, up into the mouth so that you can actually swallow them to get rid of them. Okay, so let's just summarise the active cycle of breathing then. So the relaxed breathing, or the breathing control element, is to be done at the beginning of the cycle and after each of the other elements such as the FET and the deep breathing. The cycle of breathing, starting from the deep breathing to the hold and the sniff, moving on to the FET and the cough, should be done as many times as necessary in order for you to be able to clear the secretions from your chest. This may be morning and night time, it may be several times throughout the day, or it may only need to be done when you have a chest infection. It's very dependent on your current situation. Sometimes people feel that there are more secretions on their chest after a night time of sleep. Obviously, if you've been laying down, the secretions can pool in the lungs. So clearing your chest first thing in the morning can be really useful. Equally, if you can clear your chest before bedtime, it may mean you get a better night's sleep without so much coughing and irritation during the night. There are also some medications which can be used to help clear your chest. Some of these help to thin the secretions. One of the most commonly used ones is called mucodyne or carbacystine. You can also use saline nebulizers to clear the chest as well. Now, if you are recommended to have any of these, your healthcare professional will give you full instructions and advice as to how to use these. So to effectively clear your chest when you have retained secretions, often rather than just using one of the techniques we've discussed, you will need to use a combination of these, maybe all of them at once. You may need to use the active cycle of breathing to clear your chest alongside having a saline nebulizer, for instance. You may need to make sure you're taking your regular medication as well as doing the techniques as well as keeping up your exercise. So it's a combination of treatment that tends to work most effectively. So thank you for listening to this short video. I hope you found the information useful. If you need any further information, please have another look on our website.